Good afternoon. Welcome. My name is Dr. Jennifer Mata, Director of Diversity, Equity, Inclusion, and Accessibility. Today, January 17th, 2023, marks the 7th Annual National Day of Racial Healing. The Office of Health Equity at the San Antonio Metropolitan Health District and the Department of Diversity, Equity, Inclusion, and Accessibility welcome you to today's webinar entitled Courageous Conversations with Dr. Lauren Powell. In order to share this session with others, this session will be recorded. Recording is now in progress. Before we begin, I'd like to review a couple of housekeeping items. As attendees, your device has been muted upon entry. We will have time for Q&A towards the end of the session and invite you to post your comments and questions in the chat box for Dr. Powell to address following her presentation. This is a brave space for courageous conversation. We understand that discussions about race and racism can be sensitive, comfortable, uncomfortable, and challenging. We ask that everyone respect this brave space and remember that we are a community where all of us are entitled to feel safe, learn, and ask questions. As we come here today, let us be reminded of our common humanity so that we can begin to work on our own healing and the healing of our communities. Let us be reminded that racial injustice today, as in our past, detrimentally affects people's physical, spiritual, and emotional lives. But let us also remember that collectively, we have the potential to change and transform systems, policies, and practices so that we can begin to heal individually and in community. We have the power to promote active healing and justice for all if we are intentional in our approaches. Let our courageous conversations be the spark that puts us on a common journey. Our thanks goes out to all those people behind the scenes that make this event a possibility. Thank you for acknowledging that racial healing is central to racial equity, and we all benefit when all of us can live our healthiest and happiest lives. A special thanks to my department, DEIA, for all their support. You are wonderful. Thanks goes out to the Metro Health family, specifically Mr. Claude Jacob, Director, Marjorie White, the Assistant Director of the Community Health and Safety Division, and their Office of Health Equity team for organizing this event. I think your team is awesome. We will now have the introduction of the speaker by Mr. Claude Jacob, the Metro Health Director.
Thank you, Dr. Mata, and welcome everyone once again. I'm Claude Jacob, the Health Director of the nationally accredited San Antonio Metro Health District. I have the distinct pleasure of introducing this afternoon's featured speaker. Before doing so, I would like to take a brief moment to thank City Manager Eric Walsh, the Department of Equity, Inclusion, and Accessibility led by Dr. Mata, as well as the Black African American Employee Affinity Group for helping to mobilize today's virtual session. The Black African American Employee Affinity Group was formed as a standing forum following the tragic death of George Floyd that occurred in May of 2020, and is the city's effort to check in from time to time on our Black and African American friends and colleagues. This group is led by our Assistant City Manager, David McCary, and colleagues across the city. Please be on the lookout for upcoming events to honor Black History Month, which will be celebrated next month in February. So to learn more about the Black and African American Employee Affinity Group, or if you're interested in joining, please contact, and again, you can see the information on the screen, the African American Affinity Group at sanantonio.gov, or visit their webpage. So with that, let me introduce this afternoon's speaker. Named among Fortune's 40 under 40 in healthcare, Dr. Lauren Powell serves as the president and CEO of The Equitist and concurrently serves as the inaugural vice president of U.S. Health Equity and Community Wellness at Takeda Pharmaceuticals. As a founding leader of The Equitist, she helps systems and leaders move from embracing health equity in theory to action by equipping them with the tools to dismantle racism and other oppressive forces operating within our healthcare systems. Workshops, executive and individual coaching, and keynote speaking, she shifts mindsets, sways opinions, and enlightens the leaders who are shaping policies and making decisions that impact everyone's health. For more than a decade, Dr. Powell has been immersed in broad and progressive leadership positions where she's been unapologetically outspoken about racial injustices and health inequities. Her professional and personal experiences have led her to spearhead equity-centered efforts in healthcare, state government, academia, and public health, and make her a nationally sought-after leader, speaker, and consultant on all things related to health equity. Formerly the Director of Health Equity for the Commonwealth of Virginia, Dr. Powell was the youngest Black woman and the first with a PhD to serve in this powerful role, where she led statewide strategic plans and initiatives towards pushing Virginia's 8.5 million residents closer to health equity. Dr. Powell has an established track record as a community-engaged social epidemiologist with doctoral training on systems change thinking and how to leverage data for equity. She earned a Bachelor of Science in Biochemistry from Xavier University of Louisiana, has a Master in Public Administration from the Harvard Kennedy School of Government, and earned a Doctor of Philosophy, or PhD, in Clinical and Population Health Research from the University of Massachusetts Medical School. Celebration of the Reverend Dr. Martin Luther King Jr.'s birthday and the annual march that was held on the city's east side, this afternoon's forum is intended to be a generative, reflective, and thought-provoking virtual space demonstrating our commitment to foster constructive dialogue with one another. So to our COSA community, and without any further ado, I'll now present to you Dr. Lauren Powell.
Well, good afternoon. Thank you so much, Claude, and thank you so much to the City of San Antonio for having me this afternoon. It's appropriate for us to think about, what does the National Day of Racial Healing really mean for public health? Like, what does it mean for us in particular? I have this idea that racism is actually a public health emergency, not just a public health issue, but an emergency. An emergency is very different than just an issue. And so I think this is a very important lens for us to look through on the National Day of Racial Healing, specifically as public health leaders. First, I always like to introduce myself. I am Dr. Lauren Powell. Thank you, Claude, for reading my bio. It was a little extra, but I appreciate you going through all the detail. I help systems and leaders move from health equity and theory to action. I help challenge leaders to notice and intervene on how racism operates within themselves and therefore also the systems sometimes that they help lead. And I shift mindsets and sway opinions and enlighten leaders who are really making crucial decisions on things that impact our health every single day. And the reason why I do this is because I've lost too much of my family and my community to racism and preventable health inequities. I am personally very tired of lip service on health equity and racial equity without meaningful action. And I think that health equity is an urgent issue of life and death. The people who are pictured on here, with the exception of the picture in the middle of me and my mom selfie, have all passed away as a result of health inequities. And so it's important for me that I constantly center myself in why I do this, why this is important, and how the words and kind of the phrases we use in public health actually really have meaning and impact to people, changing people's lives. So today is the National Day of Racial Healing, and you may not know what that actually is. And so I thought it would be important to first ground you on what this day actually is. It's actually a newer sort of designation and acknowledgement, if you will, national acknowledgement. It's created by the W.K. Kellogg Foundation in 2017. So this is actually the 7th year of observing the National Day of Racial Healing. It's part of the truth, transformation, and racial healing movement that the Kellogg Foundation is leading. This is a day that is observed across the country and across lots of different sectors as well. And so I'm so pleased to see a local government system, as well as specifically even public health system, observing and honoring this day. And what the Kellogg Foundation wants to do is see folks across the country connect, build relationships, and bridge divides. So I think that's important sort of grounding for like the whole purpose of this day. Now, I think we can all certainly remember where we were, what we were doing, um, when we found out about the murder, the untimely murder of George Floyd. 2020, take us back to, the moment when we were still somewhat quarantined. We were still locked away in our homes, and some of us, actually, some of our public health workers, which I should stop and thank you for that. First of all, let me begin with gratitude and thanks for all of the work that you all have been doing, continue to do, continue to be on the front line of the ongoing pandemic, because we do know it's not over. So let me thank you for that. But as we sort of think back into where we were at that time, this was a moment that I don't think any of us will forget in our lifetime. The murder of George Floyd and the impact it had on the nation, really kind of reminding us and bringing us back to the reality that racism continues to be a problem, that it was never really solved. It never kind of just faded to the background, although for some may think that racism was not a problem, and that like George Floyd's murder just sort of ignited something that had gone away. But if you talk to folks in BIPOC, Black, Indigenous, people of color in those communities, many of them would tell you racism never went away, right? We have the reality that racism is a pandemic too, that there were protests and just outrage really across the country, across the world at that time. And then, public health, which I think was so very important and appropriate. Many of our public health departments and city governments, the role at that time, I think we all sort of leaned into this moment and the opportunity to really declare racism as a public health crisis. Now, it's actually interesting that Milwaukee, Wisconsin, I think was the first city to actually declare racism as a public health crisis, like back in like 2012 or something like that. So all of a sudden then, as the murder of George Floyd prompted so many different sectors of society to speak out and say something about racism, to suddenly declare that Black Lives Matter, to put out really well-written, crafted statements on their websites talking about how they stand with Black lives and that racism is intolerable. And so public health, our sort of walk into that was to declare racism as a public health crisis. So around then, more than 50 city declarations put racism's health impacts on par with disease and addiction. And so we had this really big wave of organizations really taking a stand and saying that racism is a public health crisis. In fact, the American Public Health Association has taken the time to really categorize this. They created an interactive map on their website, which I really encourage you to look at. An assessment and a review of the municipal declarations and resolutions across the United States. 240 plus declarations of racism as a public health issue, which is admirable. I do think that's important. It's important to raise awareness about racism as a public health issue, and to see so many different states at least have some municipality or some portion of the state, if not the state as a whole, declaring that racism is a public health issue and really shining a light on that. But I beg to differ. I do. And you'll come to find out I beg to differ on quite a few things. Racism to me is not a public health issue. It's in fact an emergency. The difference between the two being that, well, actually, lots of you all know the difference between the two, right? You've actually worked through an emergency. You have led through an emergency. Emergencies are different than issues. I think that racism is a public health emergency because of the significant impact it has on communities of color across the country. For example, we know that the toll of health inequities on Black America results in 74,000 more deaths per year on par as compared to white populations in the white communities. This is a source from the American Medical Association. This is an actual study that was conducted, and that tells us that this is a significant impact on an entire community. So if we had any other disease, any other parasite, microbe, organism, airborne organism that caused this much destruction, left this much of an impact on any other population, I think we would quickly declare that not just an issue as something to sort of keep an eye on, but an actual emergency. And we have a history of racism in healthcare that has really laid a foundation as to why this is an emergency. How it went from an issue, I think, over time to now evolve into an emergency. The history that I don't have all the time to go into, but I would love to share with you in the future sometime. A history of experimentation on Black and brown bodies, as we look in the top, my top left corner, where we see J. Marion Sims, who is heralded as the godfather of gynecology, who is a physician who perfected many of the procedures and many of the treatments that we still use in obstetrics and gynecology today. He perfected those techniques on the bodies of enslaved African women. And it is actually written in his notes, and there's research to corroborate that he perfected these techniques by conducting surgery on these enslaved Black women to the tune of 40 times, conducting the same sort surgery over and over 40 times without the use of anesthesia. So you can imagine how deeply painful, how deeply traumatizing that is, and how those experiences have continued to impact Black and brown communities even today. And so Dr. Marion Sims, there's been a lot of talk about him actually in the past several years. Actually, there's been a lot of really thinking about his legacy and how we actually put that through a filter of racial equity now and really question those techniques and the ways that has continued to impact Black and brown communities even today. To the next picture, which shows physicians who actually used Black bodies to perform surgery on in anatomy and physiology, and that there is a documented history of how Black funeral homes and also Black grave sites were often robbed for bodies to use in order to continue to learn medical history, medical techniques. And then we have the infamous study of untreated syphilis at Tuskegee University, where a group of Black farmers were told that they would be undergoing treatment for syphilis. It was actually more of an observational study that led to a significant amount of distrust and mistrust that still exists today. And ultimately, those men were never really treated for syphilis. And in fact, when a medication that was actually discovered during this 40-year-long observational study, when a medication was discovered that could actually treat syphilis, they were not offered that medication. And so that has had generational impacts that we still continue to see today. We've seen even throughout the COVID pandemic in the ways that we've had differences in uptake in vaccination, differences in uptake in misinformation, and a lack of trust truly all around. And so this has really laid a foundation. The racial inequities and the racism in this area has actually laid a foundation for how this continues to impact us today and how racism is actually a public health emergency. A legacy of unequal treatment, which is an entire report that was put out by the Institution of Medicine, which is now referred to as the National Academy of Science, Engineering, and Math. But a legacy of unequal treatment is something that has already been documented, right? This came out in, I think like the entire documentary came out in like 2007, I want to say. But this was an entire study that was commissioned by Congress to ask like these questions about why are there differences in health outcomes and what does that actually mean for Black and Brown communities across the country? And actually, is there something physiologically different, or is there a difference in treatment? And the answer is that there's a difference in treatment that is rooted in racism and other forms of systemic discrimination. So I think that some of these things really help us understand the foundation as to why I think that racism is a public health emergency. And in order to address an emergency, this is why I think it's important we make the distinction between an issue and an emergency. In order to address an emergency, it requires dedicated resources to tackle, requires a coordinated response, and it forces us to move with urgency. So, an issue, it's great to raise awareness about an issue, but raising awareness about public health, racism as a public health issue is different than declaring it as an emergency. Some may say on this day of National Racial Healing that racism, maybe it is an issue, maybe it is an emergency, but what does that actually have to do with me? If I am not a part of a Black, Indigenous, or people of color community, what does that actually have to do with me? Well, thank you for asking, because the answer is that racism actually hurts all of us. It actually hurts all of us. Contrary to popular belief, this isn't just an issue for Black and Brown communities. Isn't just an issue maybe for immigrant communities as well. This is an issue that impacts all of us. We have a very real-time example of what that means. We can think about the COVID-19 pandemic and the ways that we saw a very illustrative example of how our health is connected. My health is connected to the health of my neighbor. So really being able to better understand the trends in where the disease was happening, thinking about those who were on the front lines and how we had to make sure that those folks were protected in order to make sure that all of our communities were protected, right? So racism, when it continues to be embedded in our public health and our healthcare systems, it does not simply hurt Black and Brown communities. It is something that erodes from the quality, the equity, and the overall livelihood and the benefits of our entire healthcare and public health systems for all of us, not just for the most marginalized. And so I think the antidote for this, if we know that racism is more than a public health emergency, it is a public health issue, well, what do we actually do then? What is this tool that we have to apply to this really big emergency? Well, I actually think that's health equity. And I think that health equity is so important to apply to this topic and to this issue because it requires us to wrestle with racism and systems of power and privilege. It is also most appropriate for us to discuss the true meaning of health equity and how important it is on this National Day of Racial Healing. So health equity is actually when all people and communities have the opportunity to attain their full potential and highest level of health. And of note here, equality is not the same as equity. So I know that these words kind of sound very similar. People use them interchangeably, but let me caution you that they are not the same word. They do not have the same meaning. Equality is what we see on the left. These are actually updated graphics from the Robert Wood Johnson Foundation. You may recall, especially my public health folks, seeing the 1.0 version, I think, of their framework, which had like bicycles. This is an updated framework that they've just put out, really illustrating equality versus equity. So equality is demonstrated here in this graphic and showing that everyone gets the same thing, regardless of whether it's needed or right for them. What we see on the other side is equity, demonstrating that everyone gets what they actually need, understanding the barriers, circumstances, and conditions of each individual. So if we look at the graphic in purple, we see that everyone's just getting the same thing. There's a curb that the person in the wheelchair with a disability, there's a man with a walking stick, cannot actually use. There's nothing that they can use there. Everyone's just getting the same thing. And so the people who are most privileged are further privileged by equality. What we see in the blue graphic is equity. That is taking into consideration all of the different needs of everyone who's pictured here. So that's taking into account a ramp that can be used for the person who is operating in a wheelchair, who can also be used for the person operating with a walking stick, taking into account auditory and disability needs. So really thinking about diversity, equity, inclusion, and accessibility in a very broad umbrella. And ensuring that everyone gets what they need and really taking into account the specific barrier circumstances and conditions for each individual. I could put it to you one other way. A mentor of mine says that equality is giving everyone a pair of shoes, right? So imagine, Oprah show, like you get a pair of shoes, everybody gets a pair of shoes, right? But equity is giving people shoes that fit. So just because I give you a pair of shoes doesn't mean it's what you asked for, doesn't mean that it actually fits, doesn't mean it's what you want. And so how do we take that framework and then apply that to our public health work, to our work as government leaders? In thinking about just because we offer a resource, just because we toss a program or an intervention out there, doesn't mean we have tailored it specifically to the communities who need it and in the way that they need it the most. So, I think here's the problem in my lens, in my opinion, around racial inequities and our public health outcomes. I think we have too many public leaders who don't realize that our commitments to health equity often fail to translate to action, right? So just because we say that we're committed to health equity, just because we declare racism as a public health issue, that does not necessarily translate into action a lot of times, right? A declaration isn't enough. Acknowledgement isn't enough. It must be followed by action. I think we are too removed from the lived experience and community voice to recognize the life-altering and sometimes life-ending consequences of our decisions as public health leaders, right? When you make a very, quick decision on where to withdraw funding for a particular clinic, for a particular community, and perhaps move it somewhere else, or close an entire immunization clinic in a place where folks can actually take a bus or public transportation to access it and move it out to the suburbs, that has life-altering and life-ending consequences for people. And I think we are too removed from lived experience within these communities and hearing the community voice to actually recognize the impact of our decisions. And I think too many of us remain willfully ignorant and boldly fragile about racism and how we perpetuate it. That we are not willing to do the deep interrogation, the uncomfortable examination, to challenge ourselves to see the ways that we are upholding racism in our systems, in our individual interactions, and in the ways that we aim to provide public health services for entire communities. But here's what I actually think is possible. I think that we can transform and save lives by preparing public health organizations and leaders to activate and apply health equity. And remember, intrinsic to applying and activating health equity is understanding the need and our requirement to dismantle racism. So I like to make sure that I never leave folks without ways to champion health equity. I think sometimes I go to a lot of talks and, people just kind of talk. And at the end, you're like, well, what can I actually do with all this information that's been given? And so I like to make sure I leave you with a few things to think about. I think that 5 ways you can help champion health equity. 1, you can declare racism as a public health emergency. Your city, state, county, or area designation. I think you can declare racism as a public health emergency. Maybe not right away, right? Maybe that takes some strategy. Maybe that takes some time, some negotiation, some persuasion. But I do think that is one really big way to champion health equity, and not just declaring it, but doing something about it. And declaring an emergency forces us to do something about it. That's why I think it's an emergency, not just an issue. 2, you can require your entire team or staff to participate in annual anti-racism and community engagement training. Annual, right? And maybe even more than annual. It could start with annual, but continuous, ongoing. This is not a check the box one and done. So I hope that in hearing this today, in the National Day of Racial Healing, you don't say, "Great, I've done what I'm going to do for racial healing for the year." That's not it, friends. This is not a check the box thing, right? It's an annual, ongoing interrogation of our thoughts, our practices, and the ways that we operate. So requiring your staff, offering opportunities, ongoing opportunities to participate in annual anti-racism and community engagement training, so essential and a really, really important way to champion health equity. And I do say community engagement training because I do think people need training before stepping out into the community, right? There's preparation that's needed before just jumping into several communities. And I say this from personal experience, right? I have made the mistake myself of thinking I could just jump right in. And it takes training, it takes time, it takes the building of relationships, which we need to set sort of the stage for before we just jump out there. Reframing, you're thinking from blaming people for their circumstances to calling out systems they exist within. So, I hear this so often that there's a tendency in healthcare and even in public health folks to I guess draw maybe a causation, we could say, even a causation between race and health outcomes. And it is not race, right? Being Black is not the problem. It's being Black or brown or a person of color within a system of racism that is the problem, right? So I think reframing your thinking around shifting from blaming people, so it's sort of victim blaming, to blaming the system that is the cause of victimization, really will help challenge and change the ways that you implement health equity interventions. So really focusing on root causes, then that means. So not focusing just on, sometimes I've talked with some healthcare organizations and challenge them on, policies, very simple policies around like being late to an appointment. Okay. So you're 15 minutes late, your appointment's canceled. So do you understand that's actually a little bit inequitable, right? Because you're just assuming people are just running late. Are you not thinking about perhaps the fact that your no-show rate in some of your clinics might be related to the fact that there are underlying root causes for people being tardy? There are multiple buses people may have to take. People may have to take an Uber, right? People may have to walk. Like, we have to think about not blaming people, but thinking about the systems they exist within and focusing on root causes. 4th is considering who may be the subject of a discussion, but not present to advocate for themselves or their perspective at the table. And finding ways to include them as a priority and not an afterthought. This happens far too often, that we write lovely grants, we write 25-page, well-written NIH, RWJF grants for millions of dollars. We write in community partners, we literally write in descriptors about them, what they're going to do, how much they're going to get, and then we invite them to the table after we've received the money. If that's what you're doing, you are not advancing health equity. In fact, that in and of itself is stripping the voice from communities, especially marginalized communities, especially Black and brown communities. Stripping the voice away from those communities is in fact advancing racism, right? So consider who may be the subject of a discussion. Who are we talking about? Who are we talking around without actually inviting them, asking them, prioritizing their presence at the table? And 5th, you can distribute your power, privilege, and resources to the community by hiring from the communities you serve. paying community partners equitably, supporting BIPOC-owned suppliers, meeting spaces, vendors, speakers, etc. There are so many more ways other than just our traditional sort of definition of public health services. There are so many more ways that we can be advancing health equity. We can be advancing anti-racism. We can be further moving along this agenda for the National Day of Racial Healing, other than just our traditional public health services, right? Anytime we interact with community leaders, we should be honoring and respecting them at the same level that we will honor or respect one of our colleagues. And there are so many different ways to distribute our power and privilege and resources in doing so. So I will begin to close here in challenging us to see that dismantling racism is our responsibility in public health too. We don't get a pass, right? In this National Day of Racial Healing, I really want to encourage you to think about the ways that racial healing and advancing anti-racism within public health is our responsibility too. There are lots of different ways we can do this. There are lots of different ways we can even start. It doesn't take an act of God in Congress to do everything, right? It also doesn't take money sometimes to make these really deeply impactful changes. It is a change in mindset. It is a change in the way that we approach our work every day. And that will indeed transform our impact. So I think health equity is our antidote. Health equity requires us to advance racial healing, requires us to commit to anti-racism. And if you are not addressing racism, if you are not addressing systems of power and privilege and discrimination, and you are labeling the work that you are doing as health equity work, I regret to inform you that is not what you are doing, right? That's not what you're doing. So on this day of National Racial Healing, I want to encourage you to lean into the full responsibility of health equity, to the full responsibility as public health leaders for us to work on dismantling racism every single day, not just on national holidays, not just on Martin Luther King Day, not just on the day of National Racial Healing, but every single day. And with that, I want to thank you so much for your attention, for your invitation. I'm happy to answer any questions you may have, and I will stop sharing. Well, I'll give you a chance if you want to. This is actually a virtual business card. Feel free to, it's a QR code. Feel free to scan it. You can connect with me. You can also find me on LinkedIn or Twitter, and I'd be happy to connect with you. So thank you so much.
Oh, thank you so much. Such powerful words. And I know I'm fired up, and the folks in my office right now are fired up. And it's my hope that the 121 attendees that are on this webinar today are also ready to go as we continue our work. We do have a few questions that are in the chat box right now. But you made some powerful points. I love how you said racism is not a public health issue, but it's an emergency. And given that we're just, kind of dying down with this COVID pandemic, although it's still present, looking at our response, our immediate response to address it, to remedy the exposure of this moving forward is the same sort of rapid response that we need regarding dismantling racism across all aspects of our culture. And so thank you for that. The questions that we did receive is, you talked about Minnesota being one of the leaders regarding addressing health inequities. And so folks wanted to know, what are some other communities that are also leaders in this charge, and what makes them leaders?
Yeah, that's great. Thank you for the question. So Minnesota, I think Wisconsin, so Milwaukee. I think Milwaukee was the first actually to declare.
Milwaukee.
Yeah, Milwaukee was first, and then Minnesota. I think California is also always very progressive. King County and Seattle, Washington. So those are some of the bigger leaders, I think, in New York City, of course, and New York City is always like very, very cutting edge. I think what makes them leaders is their Boston. Yes, thank you. Boston as well, for sure. Very cutting edge too. I think what makes these jurisdictions leaders is that they move, they put they put action behind their talk. So it's not just that they're putting these things out, but there are concerted efforts for policy change. Like I remember the pilot in California around, providing a stipend essentially for Black and Brown women during very early on in pregnancy to see how that would impact, maternal and infant mortality. So like, changes with like Medicare coverage and changes like actual policy changes, as well as interventions that are created with, sorry, that was my timer, that are created with sustainability in mind. So I think that's sometimes what we don't think about enough. And I'll say in some of my experiences across lots of different sectors, all in healthcare, really trying to advance health equity. I think one of the challenges for us as public health leaders, and I say us because I was a state government public health leader. I was the director of health equity for the Commonwealth of Virginia. And I think I have so much more enlightenment now around some of the challenges in my ways of thinking, even in that position. And I see it reflected in lots of different public health leaders across the country, is that sometimes we don't build at the beginning with the end in mind. So we create really wonderful interventions. We get, money and funding is a whole nother issue that I don't think is totally our problem, but we get small drops of money. We put together elaborate and fantastic interventions that really change people's lives, but we don't think about how to build in sustainability at the very beginning. So what happens when this $250,000, $2.5 million grant runs out? Who have we equipped? How have we helped community partners perhaps, tap into additional funds? How have we perhaps lobbied for legislation that will continue to make funding available to keep this intervention going? How have we tapped into the private sector to actually see, would you be willing to foot the bill for this and to continue to support this? And so I think some of those jurisdictions that I shared have found some very creative ways to do just that, and to ensure that their actions don't become short-lived, that they become like a permanent way of life, if you will.
The next question, please talk more about effective versus ineffective diversity trainings. Please discuss evidence base. What are the hallmarks of effective trainings?
Well, I thank you for the question. I think diversity trainings are completely ineffective as a title. I'll start there. I think we use diversity in a way that makes it very surface level and waters it down significantly. And I think diversity means nothing without equity, inclusion, accessibility, belonging, like it's an entire, and justice, most importantly, right? It is an entire it's an entire entree. Your diversity is the side, right? We need the whole entree. So I think that effective workshops and learning experiences, because I also don't like training. I don't like the connotation of training. I think that, first of all, they have to be long-term. So this can't just be a drop in the bucket. It can't be, we do this when a problem happens. We do this when a national emergency happens. We do this when a big social justice issue happens. It has to be ongoing. Much like we as public health leaders, like we're required to do lots of different certifications all the time. This should just be a part of that, right? So I think that's one. Two, any sort of learning experience that is completely devoid of history is not even worth it. It's pointless. Because if we don't understand the history that has created the systems, has created many of the challenges that we are still fighting today, then we are more than prone to repeat it and or to negate its existence, right? So this must be rooted in history. This must be rooted in fact. And it must also include the voices of those who experience the impact from it the most, right? So I do hope that we get to a future where, um, all leaders of health equity, diversity, equity, inclusion are more than just people of color. I do think that that's really important, right? But I think to have entire learning experiences around diversity, equity, inclusion, health equity that are void of voices from communities of color, that's also a problem, I think. And I think it's important that those folks have the autonomy and the space to speak to their lived experience and how these concepts that we throw around really have real life implications and connotations. And then I think, finally, I think what makes an effective sort of line of programming is that it has to start with leadership. This cannot be something that's just middle management or just folks who work in the field. The community engagement team is the only one who does sort of these, or the Office of Health Equity is the only team that has these conversations. That is completely ineffective. And it will not last. So it must be upheld by leadership. It has to be demonstrated and absorbed and embodied by leadership.
Next question. How would you engage Black, Indigenous, and people of color communities in helping write grants? Can you please expand on this?
Oh, great question. Thank you for that. I think so. First, I think it's like I said, sort of in my presentation, I think it's important as soon as you know of a grant opportunity, share it. Like, share it immediately, right? Like, oh, I saw this. We would love to potentially write for this. Would you be interested in being a part of the team to write for this? Would your organization be interested in being a part of this? And lay out what that means, not just, hey, we want you to be part of it. What we mean by that is, one, we will pay you for your time. Two, we will include you in writing this grant. Three, we will publish with you or whatever the intervention is. So be very specific about what inclusion means. It's not just, hey, is it cool if we drop your name in this? It's more than that. I think, two, then invite them to the table, listen to their ideas first. So we're really bad about this, right? We come in with the preconceived notion, oh, we've already built up. We know exactly the intervention that's needed. We know exactly who the community partners are. We know the perfect block to put this on. Here's the call for applications. There are some thoughts we have, but we'd love to hear yours first. Allow them to be a part of the brainstorming process, right? And I would say, most importantly, please pay them for their time. This is not volunteer. We pay grant writers thousands of dollars, right? And we expect then that community leaders, community voice is to be incorporated for free. That is to devalue the expertise, the lived experience that they bring to the table. That in and of itself, again, is a form of advancing racism. So please, pay people equitably for their time. I'm not talking $5, $10 an hour, equitably for their time, right? So include that. And then I think there are lots of different other ways that you can approach these communities. I think it's important to have some, like, foundation of a relationship first to begin with, which is why community engagement, and I really think community integration, which is a level that's different than engagement, because engagement says to me, like, I can engage with you when I want to and not. We really should be working to be a part of the communities that we serve. So I am the community is me. And when we have those types of relationships, then approaching folks for grant opportunities and to write together and to co-produce potential, interventions and works will come with it's a different ask, because you're not a stranger. You're someone who's around the way, who I see all the time. So it's very different. I think we still have a lot of work to get there, but that is ultimately the best way to begin a conversation with Black and Brown communities around grant writing.
Awesome. We have two more questions. What are examples of actions we can take to build deep, authentic community trust?
Yeah, thank you. Thank you for this. This could be a whole separate sermon in and of itself. So I will try to be brief, but I would love to share more of my thoughts on this in the future, maybe with you all. First, I think there's a reframing that has to happen around trust, first and foremost. So it's not just that we should be expecting communities that have been marginalized, disenfranchised, traumatized, right, to just flip a switch and trust me, right? Yes, perhaps I have hurt your ancestors. Yes, perhaps I have hurt your community. Maybe I have even hurt you. Maybe you've not had the best experiences coming to receive healthcare or even public health services, and yet all of a sudden we just trust us, please. I think that's unfair, right? It is, the onus is on us to present ourselves as trustworthy, right? There's a difference. So the burden is not to just be shifted on individuals, on Black and Brown communities, any rural communities, even, right? Who have immigrant communities who have experienced trauma that has made them feel like, well, I don't trust this organization, this group. It's on us to present ourselves as worthy of their trust. And so to me, that means starting with real community conversations. I think literally hosting. So when I was at the Office of Health Equity, we literally hosted community conversations. Like it was we did a couple in rural parts of Virginia and tried to do it across the state. We did a couple in rural parts of Virginia, some in like Richmond and across other parts of the city. And so we worked with a community-based organization that we had a strong relationship with. We said in the rural area, we actually said we want to host come have supper with us, right? That's very Southern. Y'all will understand that. It's very Southern. Okay. So we said, come have supper with us. And we had dinner and we just talked. We were like, so tell us what would help you be healthy? What would help, bring longevity to your community? What does health equity mean to you? Have you ever heard that word? Like, what does it mean? And let us tell you, this is what the social determinants of health is. And it's like a real academic phrase, but what we're trying to say when we say that is X, Y, and Z. Does that actually resonate with you? Or those are things that actually impact your health and wellness and the outcomes for health in your community? So I think like authentic communication and conversation, that's really just it. Like that has to be the first step. And I think doing this in disarming ways, not a focus group, right? We had supper. Supper was a focus group, but we didn't call it a focus group. So it was having supper and people came and ate and enjoyed it, brought their kids. Like it has to feel fun a little bit. It has to feel like you really do care about getting to know people and you're not just there to do a CHA. You're not just there to do like a state health assessment or a community health assessment or report back on your behavioral risk factor surveillance system, numbers. Like maybe that is your intention, but I think we can present ourselves as a little bit more authentic than that. And then I think, making sure that we're showing up, not just when we need something. That's whack. Like we wouldn't even do that you wouldn't want to call someone your friend who only called on you when they needed something, right? So we have to really like apply these same principles that we live every single day with each other to how we operate within communities.
Dr. Powell, thank you, thank you, thank you. At this time, we're going to transition to a mindfulness activity. I'm very pleased to introduce Ms. Lizette Garcia Rubio, who's one of our community health workers within Metro Health for our Healthy Neighborhoods program. She started doing this because she saw violence growing in her neighborhood, and she wanted to focus on yoga and mindfulness to help people heal and find peace within themselves. Our team wanted to ensure that because we're having these courageous conversations, that those who are in attendance are okay. But this is our check-in with you because we know that this topic can be uncomfortable. But the fact that you're here, that's a starting point as we continue to work towards more change and equity across everything that we do. So at this time, I would like to turn it over to Ms. Lizette Rubio. Thank you so much.
Thank you, Megan. So let's start this meditation by just checking our body. We've been here, we hear a lot of stuff. So let's check a little bit everything, letting the blood circulate around all your body parts. And while breathing deep in, bring your shoulders toward your ears. Now exhale, bring your shoulders down and let them relax. If you feel comfortable, you may close your eyes or you could leave them halfway open. Let's first consider what is here. What is difficult for you right now? You may be feeling some anxiety, fear, maybe a sense of overwhelm. Maybe you have a physical sensation, tension, throbbing, pressure. What is happening in your body right now? Let us recognize that it's normal to feel this way. Many people are going through this right now. These feelings are just part of being human, part of the human existence. Now, let us offer ourselves some kindness. Something like, may I be kind to myself in this moment? Or, I'm here for you. I care for you. If you feel comfortable, you may place your hand over your heart. Put your fingers to some tapping on your heart. Leave your hand in your heart in a way that feels good and soothing to yourself. Let's bring these feelings of care out to your community. Bring it into your mind a loved one that you are concerned about. Bring to your mind all that were impacted by today's talk. Imagine them in front of you and let us wish them well. You may repeat in your mind while holding these people in your heart. May you be free from harm. May you find ease. May you be happy. May all be strong and healthy. May we all remember how connected we are. May we all remember that we are connected with the resilience of our ancestors. As we close, just notice how your body feels right now. Allowing whatever is here to be here. As you move on to your next thing, I invite you to see the people around you with kindness. What truly will serve you and serve those around you. I invite you to wish them well. Just in your mind, say the name of the next person you know you will see, and say, I wish them well. And right now, I wish each one of you well. May peace and love surround your day. Namaste. Thank you.
Thank you, Lizette. Wonderfully done. At this time, I'm going to turn it over to our health director, Mr. Claude Jacob, for the closing remarks.
Thank you, Marjorie. Thank you, Dr. Powell, for leading us in a very courageous conversation about racial healing and its impact on health equity. For the public health purists on the line, this is an illustration of essential service number 3, about how we communicate more effectively in order to inform and educate about health issues. So although these conversations can be uncomfortable, it's necessary in order for us to move collectively forward, to heal, to be unified, and embrace each other's uniqueness and thrive together. So with that, special thanks again to Dr. Mata and the Department of Equity, Inclusion, and Accessibility, as well as our fantastic, fabulous Metro Health team, the Office of Health Equity, woo-woo! Again, led by Assistant Director Marjorie White, as well as our fantastic team, our marketing and communication folks, led by Sonia Gonzalez. And so we could not do this by ourselves, and they worked so diligently to help make this day possible. So I'd like to thank our city's leadership and all of you for your support of today's event and other efforts to recognize the need for racial healing and efforts to embark on positive change. So as we prepare to adjourn, again, our fantastic team at the Office of Health Equity has prepared a comprehensive listing of wellness resources to gain more information about racial healing and resources to support each and every one of you on this shared journey together. So the wellness resources will be circulated or posted immediately following this webinar. And as the saying goes, what we know dies with us, what we share grows. And so thank you again for joining us for today's National Day of Racial Healing. Be well, be safe, take extra care.
Thanks, everyone.